Regular surgery is usually made with a scalpel, a long incision, and obviously the drawbacks of that is that it takes longer to recover, there's more pain, and the incision is more prone to have infections. What we're doing now is doing the same type of surgery but through very small incisions, each about a centimeter in size. And with that approach, the incisions are smaller with less pain, and patients do better, get out of the hospital quicker, get back on their feet, go back to work, all those things.
What's different about the Da Vinci system is that the laparoscopic surgery that we're able to do, we now have three-dimensional visualization. And the robotic instruments have a greater degree of freedom. So the instruments are wristed, so you can accomplish more internally than you can with the straight stick conventional laparoscopic instruments. So it allows us to get around corners, accomplish more difficult surgeries laparoscopically than we would have been able to previously.
So the potential benefits is that when she wakes up, she will have 4 or 5 very small incisions versus one long incision. And so right away, the requirements for pain, medication are a lot less. The patients are drinking fluids by the first night after surgery. And I would say the majority of them actually are going home the day after the surgical procedure.
We deal with cancers of the female reproductive tract. So typical surgeries that we would perform for female cancers would be radical hysterectomies for cervix cancer, hysterectomies with lymph node removal for endometrial cancer or cervix cancer. We can also take out ovarian tumors that are in early stages and perform the same staging procedure laparoscopically as well. We also, as gynecologists, do a number of benign conditions such as fibroids or heavy bleeding. I personally have an interest in pelvic reconstructive surgery. So I do reconstructive surgery for pelvic prolapse. It happens oftentimes after women have babies and they're older, things kind of fall. And I do a procedure robotically where we lift things up internally with the laparoscopic approach, and women stay one night in the hospital. Just like with any technical skill, I think the more you do, the better you become at it. And in robotic laparoscopic surgery, people often talk about learning curves. I'm almost up to 500 cases, and I think that's well above the average. But I think it is important when you're choosing to have surgery to find somebody who is experienced with whatever technique they're using. And also not just the surgeon's experience with the equipment, but the whole team. And at Camino Hospital, we have a team of professionals, nurses, and scrub technicians who are very familiar with the whole process. So the whole robotic surgery process goes more smoothly.